All right, today we're tackling a topic that is frankly terrifying. We're talking about bacterial meningitis. And this isn't just an infection you can wait out. No, this is a full-blown medical emergency where every single minute is critical. So let me ask you this. What if a simple headache, something you'd normally just take an aspirin for, could turn into a life or death situation in just a few hours? I mean, think about it. You wake up, feel a little off, maybe a headache, a slight fever. You think, it's just the flu, I'll sleep it off. But with this disease, hours later, you could be in a fight for your very life. That's how fast bacterial meningitis can strike. It's just incredibly deceptive.
Okay, so to really get a grip on what's happening here, I want you to picture your brain as this heavily fortified castle, right? It's the command center for your entire body, and it's built to be protected. But bacterial meningitis, well, it's like a full-scale siege on those castle walls.
So what are we actually talking about? Well, bacterial meningitis is a nasty infection that goes right for the meninges. And the meninges are basically those protective walls I was just talking about. They're 3 layers of tissue that wrap around your brain and spinal cord. When bacteria manage to break through, it triggers this massive inflammation. And suddenly, the entire command center, your central nervous system, is in immediate serious danger.
And look, I have to be absolutely crystal clear about this. This isn't a wait and see kind of thing. This is not something you can just put off until your doctor's office opens in the morning. It's a true medical emergency. Any delay in getting treatment isn't just risky, it can be deadly. Period.
So that brings up the big questions, right? How does this attack even start? Where do these bacteria come from? And who's most likely to be in the line of fire? You know, the answers might actually surprise you. Okay, first let's get some perspective. The word meningitis can mean a few different things because it can have different causes. You can see here that the viral kind is actually the most common. But the one we're focused on, bacterial meningitis, still accounts for a huge chunk of cases, almost 22%. And here's the kicker. Of all the types, it is by far the most dangerous. Now, here's where things get really interesting. The actual bacteria, the culprit, changes depending on how old you are. It's not a one-size-fits-all enemy. For tiny babies, we're often looking at group B strep. Then you jump to the teen years, and the big one is Neisseria meningitidis. For pretty much everyone else, it's Streptococcus pneumoniae. And this is so important because it explains why our prevention strategies, like vaccines, are targeted so specifically to certain ages. So this really paints a clear picture of who needs to be on high alert. You've got infants, right? Their immune systems are brand new and still figuring things out. Then you have teenagers and young adults, especially when they're packed into close quarters. Think college dorms, military barracks. That's just the perfect environment for these germs to spread. And of course, anyone whose immune system is already weakened, or someone who's had a skull fracture or brain surgery, they're at a much higher risk too. All right, I'm going to say it. This next part is maybe the most important thing we'll talk about. Because being able to spot the red flags and spot them fast, that can literally be the difference between life and death. These are the signs you absolutely cannot, under any circumstances, ignore. Okay, so in the medical world, we learn about something called the classic triad of symptoms. It's these 3 things: a high fever, a really stiff neck, and some kind of change in mental status. So confusion, being super sleepy, that kind of thing. If you see all 3 of those together, it's a huge alarm bell for meningitis. But, and this is a huge but, only 41% of adults with bacterial meningitis actually have all 3 of those symptoms. Let that sink in. That means the majority, almost 60% of patients, don't fit that perfect textbook picture. And that is so dangerous because it can cause doctors, or even you, to hesitate or miss the diagnosis. The key takeaway here is that you don't need all 3 for it to be an emergency. But there is one sign that is a do not pass go directly to the emergency room situation. And that's a very specific kind of rash. It can start out as little red or purple pinpricks. They're called petechia, but they can spread and merge into what looks like big purple bruises. Here's the classic test. If you press a clear glass firmly against the rash, it won't disappear or fade. That's a massive red flag. And why is that rash so terrifying? Because it's not a skin problem. It's a sign of what's happening inside the body. It means the bacteria have broken out into the bloodstream. That's a condition called septicemia, and they're literally causing your blood vessels to rupture and bleed under the skin. You're seeing systemic failure happen from the outside. It's the infection at its absolute worst.
And that brings us right back to the central theme here, the race against time. The second bacterial meningitis is even on the table as a possibility, the clock starts ticking, and it is ticking fast. This isn't a marathon, it is a dead sprint. I mean, look at this. The difference in outcomes is just black and white. Survival literally hinges on how fast a patient gets antibiotics. We're talking about a delay of just 3 to 6 hours, being linked to a major jump in the risk of death. 3 to 6 hours! Think about how long it can take to just realize you're really sick, get to the hospital, and get seen. That window is terrifyingly small. So what are the stakes we're playing for? Even with all our medical advances, they are unbelievably high. We're looking at a mortality rate of 10 to 15%. To put that in perspective, that's roughly 1 out of every 7 or 8 people who get this disease won't make it. And for the ones who do survive, about a quarter of them, 1 in 4, are left with serious life-altering problems. And life-altering is not an exaggeration. We are talking about devastating consequences, permanent hearing loss, even total deafness, vision loss, debilitating problems with memory and concentration, lifelong seizures. And because of that septicemia we talked about, the damage to blood vessels can be so severe that it leads to amputations, fingers, toes, arms, legs. Surviving is often just the beginning of a very long, hard fight. Okay, that was all incredibly heavy, I know, but here's where the story takes a turn. Because we aren't helpless here. We actually have an incredibly powerful weapon in this fight, a shield that can stop this whole nightmare before it even has a chance to start. It's simple, really. The absolute best way to win the race against time is to never have to run it in the first place. And we can do that through vaccination. We have some amazing, powerful vaccines that are specifically designed to train our bodies to fight off the very bacteria that cause this horrible disease. And the guidance is really straightforward, especially for those high-risk teen years. The CDC recommends that kids get their first dose of the Menax-CWV vaccine that protects against 4 common strains, right around age 11 or 12. But here's the part people sometimes miss. They need a booster shot at 16. That second shot is absolutely crucial to carry them through that high-risk college-age window. One more really important thing to know is that the main vaccine I just mentioned doesn't cover everything. There's another pretty common and dangerous strain out there called serogroup B. For that, there's a totally separate vaccine, the MenB vaccine. It's also recommended for teens and young adults, and it's what gives you that really comprehensive shield of protection. So when you boil it all down, it comes to this. Yes, bacterial meningitis is an incredibly fast and brutal opponent. There's no doubt about it. But our science, our vaccines, they're faster. They give us the upper hand. They give us a shield. So the only real question left to ask is your shield up?